You know, ShelterCare has been in this community since 1970, and not once have we had a home of our own. I guess the biggest project that we're most excited about this year is taking the 499 West 4th building and turning it from an old historic warehouse into a center for services and programs that will really allow us to transform quality. The overall cost is $3.2 million for the construction, and we're about 80% of our way there. We have just another $600,000 to raise and hope to be doing that in the early part of 2014. 2013, I think, was a transformative year in a variety of ways. We moved on to an electronic health record, which is quite sophisticated for where we have been in the past, but that actually gives us data that now we can be so smart about measuring outcomes, improving quality.
We have had this now for almost 9 months. It has helped us do more effective and efficient documentation. And I think treatment planning and assessments have become more streamlined. I think it's just essential for us to have at this point. And it's exciting because it helps us provide better services.
We have, for the last 3 or 4 years, been working on homeless medical respite with community partners, the hospitals, the insurance company, the community health centers, and other folks who are very concerned about homeless individuals who have acute care episodes. We got very close to spring and finally launched the program this summer.
We're offering a 30-day program for homeless individuals or families who are coming with someone who has a severe medical condition coming from the hospital that needs time to recuperate. So they come here to our program, and I work with them as an individual case manager to get them connected to Social Security and housing opportunities and any other case management type connections they need.
I provide medical coordination for the program, so when the clients come in, I work with wherever they've been discharged to develop a plan for them over the next 30 days. The coordination piece is really important because what we're finding is that it reduces the clients going back into the emergency room because the injury didn't heal. We're seeing that people are healing.
So we're very excited to have that up and off the ground and look forward to next year when we have a full year of a pilot program to see if the outcomes are as amazing as we expect. Always am proud of our Consumer Council. They've just done an amazing job this past year.
Hi, my name is Kelly Cyphers. I live here at Brother Nafia Housing. The theme this year was different modalities for recovery. Each month we choose a different modality for recovery. And I know in January we're having an art therapist again. One of the last things that we plan to do next year is do the Arborist Foundation. When you join for a nominal fee, they will give you 10 trees, and I would like to be able to plant one at each of the programs.
You know, ShelterCare is owned by the community, and it's the community that really makes it an organization that works or not. So we celebrate the business partnerships that we have.
ShelterCare represents an organization where when you make a contribution, there's definitely a return on investment. Thriller is a worldwide initiative to find a way to honor the genius of Michael Jackson. Each of the sites gets to raise money for a cause. And so you have people doing really fun stuff, building a really fun community. It was very fun and very worthwhile.
ShelterCare fascinates me because quietly they have a huge impact. This board has a fabulous balance between the clinicians, those who understand the funding sources ShelterCare has to deal with and the structure of the organization, and then there's those involved in the business. Hopefully, that's where I can contribute the most in regards to contacting people in our community and raising the awareness of ShelterCare. So that's a big goal of ShelterCare this year as a board. Next year our board is going to be really focused on membership and participation. We have loyal fans. They will fall on their sword over and over again for the ShelterCare effort. I think more people will do that, and our goal is to reach those people.
I think the message of 2013, the message of 2014, where we're going is we do this work together. It is a collaboration, and we appreciate all of the individuals, businesses, civic organizations, churches, schools that help us do this work. This year we made a special outreach to the Center for Family and Children at the University of Oregon with the idea that we could really strengthen our programming for children if we developed a collaborative relationship with graduate students who are focused on family health and child development. And that is beginning to take shape.
So to all of you out there who have known about our work, who have advocated for our work, who have supported our work, who actually help make this a caring community for every consumer we serve, I want to say thank you. We can't do what we do without you. Thanks.